Am I audible?
Yes, you are audible. So have we started this webinar?
Yes. So all the participants and our panelists on this
Just a
form.
moment, I'll just
Yeah.
introduce. Yeah. Right. Good afternoon. On behalf of the IIP Digital team, I, Dr. Manisha Tarpalikar, welcome all of you all. Today's meeting has been organized by the Indian Association of Physiotherapists, Navi Mumbai, Raigad District, Maharashtra State. To celebrate International Women's Day, a talk has been organized on physiotherapy for women's health care. The speaker today is Dr. Komal Kakkar, and the moderator for this webinar is Dr. Tejasri Daborkar. We are live streaming on the official IIP India YouTube channel. I request all the participants to subscribe to this channel to receive regular updates and view the upcoming webinars. If the participants have any questions, I kindly request them to write them in the chat box, so these will be answered at the end of the webinar. I now request Dr. Tejasri to kindly take over. Thank you.
Thank you, Dr. Manisha. On this very warm and hot Sunday afternoon, I welcome everyone to this session. Women is a unique creation of a God, and hence all the problems of women are also unique. There are a lot of health issues to which male as well as females they get exposed, but the problems which arise and the health issues which women face are totally different. Many of the time they remain silent, they are not referred to. A field of physiotherapy has a specialized branch on women's health which deals with all these problems, and we are happy that we are raising our voice towards these issues and rehabilitation towards it. So today, on behalf of IIP Navi Mumbai Raigad District Branch, we are inviting everyone for this session. I would like Dr. Pratibhan to introduce our local team for so. Dr. Pratibhan. So kindly unmute yourself.
Hi, I'm audible. Good afternoon, everyone. I'm Dr. Parthiban, President, Raigad District, and I'll introduce Dr. Shekhar Jambure. He is a Joint Secretary of our Navi Mumbai District, and Dr. Nikhil Ingle is a Treasurer. And our executive members are Dr. Mahua Chatterjee Madam, Dr. Tejasri Dabolkar Madam, Dr. Parag Sanas Sir, and Dr. Priya Borkar and Shwetali. They are all in the panel now. And I'll introduce our state team. Dr. Ujjwal Avle, President of Maharashtra State, Dr. Amit Gare Sir, Vice President, and Dr. Bharti Dev Madam, General Secretary, and Darshana Trivedi Madam, Treasurer, and Mansi Mehta, Joint Secretary. And I'll introduce our central team also, the President, Secretary, and the Treasurer. I switch to Dr. Tejasri Dabolkar.
Thank you, sir, for introducing. So let me take an honor to introduce our today's speaker, Dr. Komal Kakkar, who's a chief physiotherapist of Dr. Kakkar's Physiotherapy Clinic and Rehabilitation Center based in Navi Mumbai. Dr. Komal Kakkar has done her Bachelor of Physiotherapy from Dr. D.Y. Patil University, Navi Mumbai. She has done her Master's in Preventive and Community Physiotherapy from MGM University and Health Sciences, Navi Mumbai. Dr. Komal is specialized and passionate physiotherapist in the field of the women's health. She is specialized in treating various women-related problems like pelvic floor dysfunction, prolapse, incontinence, giving antenatal and a postnatal physiotherapy, global fitness during and after menopause, and definitely a pain related to the women's issue, mainly following hysterectomy. She is specialized in so. So I'm taking honor to invite Dr. Komal for today's session. Dr. Komal, over to you.
Thank you, ma'am, for such a wonderful introduction. And hello to everyone. I'm so glad to be here. It's a great honor for me, as I know many of you as teachers and some of you as colleagues. And I feel really happy to be recognized for the work that I'm doing at whatever level I can manage. And let's proceed to bring in some wonderful insights and my thoughts on women's health in physiotherapy. So just give me a moment to share the screen with everyone, please. I hope the screen is visible to everyone.
Yes, yes.
Yeah, great. So we'll directly plunge on into our topic for today. That's women's health physiotherapy. It's presented by me, Komal Kakkar. So I truly believe that it's very important for women to talk, to break the barriers, to come out and leave behind the shame in many of the problems that we suffer. It's really unnecessarily to be behind the doors, keep suffering just because we feel we're not comfortable talking about things related to our pelvis or our uterus and how that affects our entire life. So we'll be talking about this for the next couple of minutes, and let's proceed about that. So what is women's health physiotherapy? I think most of all who are attending this seminar today are already well versed with physiotherapy and the beautiful effects it brings to our life. With regards to women's health, we just focus more onto the physiology and the anatomical differences in the body of a woman and how that affects her activities, her daily life, her problems, her complaints, her symptoms. So that's what we are doing. When we are observing or assessing a woman, we need to keep in mind certain physiological changes, certain functional changes of her body, and how that could be affecting the same complaint with anybody else. Similarly, the treatment is also oriented keeping these factors in mind, and then we always like to finish the therapy by making her self-sufficient, making her independent and empowering her to understand her body and take care of it in the long term. So let's point out the most common problems which women face. So there are body aches, pains of all types, fibromyalgia, chronic fatigue syndromes. These are very commonly seen, especially in women, because the society is such that we tend to avoid pains till they become to the extreme level. So most of the time when women come to us, they are going through a complication, a khichdi of sorts of pains, not just an individual problem, but problems which eventually are interrelated because of the pressures of the body, etc. The next thing that we see is posture-induced pain, structural pain, functional limitations. This is again very much related to my previous point. So they all just merge in together because we are an entire body, not just a particular part or a particular organ. Then we have this wonderful period of life, adolescence, wherein the menarche happens, periods start, and the body of a little girl matures into the body of a lady. So a lot of problems can be seen at that time. We might be knowing young girls who are doing a lot of sports. They may tend to have painful periods or scanty periods or irregular periods. Even girls who are not doing sports tend to face such similar issues. These days, childhood obesity is an actual problem and it's worsening day by day. So even these little girls who are chubby and cute as kids, when they reach their adolescent phase, tend to have a lot of problems. Then the next phase in the life of a woman would be the pregnancy phase. So we really love to give great care pre, peri and postnatal. So that is pre is before she's even conceived. Because if you go in for a conception with a healthy body, then definitely pregnancy, the entire experience of the 9 months, childbearing, and the year after that will be much more healthier, much more faster, and pain free, definitely. Uh, Perinatal is where I say that delivery is not the time of just those 24 hours or just that 1 hour in the hospital. It's actually a 24-hour period, sometimes even longer. So, before the child is actually born, from the time when the lady's first ever contraction starts, from the when the pains start, and then the delivery happens, in that phase, physiotherapists can help her to a great extent. We can help them in understanding what kind of pains they are facing, in giving them particular postures which will assist the contractions but also help her tolerate the pain better. And then postnatal problems and needs, this is a very delicate period, and even as how my mentor Dr. Bharti Bilare would put it, as that women are very ignored in this phase, because the society is such that we don't come out immediately after delivery, we are at home. So we tend to make programs wherein she's self-sufficient and she knows what is to be done post childbirth, including lactation postures, including techniques, and including self-care techniques wherein she can ease her back on her own, because that's one of the primary complaints that I tend to hear. Also, during the postnatal phase, physiotherapists all over India are available and happy to come home and help you have a better phase, enjoy that early motherhood. Then let's go ahead in the flow before I go out and just keep on talking on one topic. So the next phase in the woman's life is the menopausal phase, and this again is not a 1 day period that I didn't get my periods and yes, menopause happened. It doesn't happen like that. It's a phase ranging from anywhere between 2 to 5 years. Menopause starts when the first symptoms appear, and menopause is completed diagnosed, according to definition, when there have been no periods for 12 months. So it's a long time wherein we go through emotional changes, physical changes, definitely hormonal changes, which are affecting every part of our body, from our hair to our skin, everywhere, bones, our weight, and then that leads to a lot of activity changes, daily life changes. Sorry. The next thing that we come to are infectious or surgical interventions which women have faced. Very commonly hysterectomies, before that C-sections, then appendix, gallbladder issues, all these things which affect the body eventually. So that's also an important role where a physiotherapist can come in and assist the lady come out of her problems. It may or may not be directly related to other physical problems that she's facing. Physiotherapy is very helpful in oncological conditions as a support. We don't treat it, but we can definitely give a lot of support during pain relief. And then post CA cases where people have been treated for breast cancers, cervical cancers, a lot of help can be provided there for the lady first to accept her new position, post the operations where organs might have been cut, and also to get back to her normal life as much as possible. Next thing is incontinence. It's a very very common problem practically in every household, but absolutely unheard of, unspoken of problem. So we know a lot of women who suffer silently. It's the most terrible silent suffering I feel women can go through, wherein definitely hygiene is an issue, other complaints. Incontinence eventually goes on to into a full-fledged prolapse of the uterus. There are infections commonly happening in the area, and there is no one that we can talk to. So we need to break that barrier and come out of it. The next thing which we would feel is which we can be helpful in is sports related problems. So there are many women who are now turning into fitness enthusiasts because we have seen how a good fitness level can prevent so many other conditions. So I think that's also a very important spot where physiotherapists can come and help them understand their body uh, and assist them with exercises that are guided, that are graded for their own system, curated exercises for their body. And if they have having any injuries, any repetitive traumas, we can help them get through them and break out of them. Again, sexual health problems, that's very commonly seen in women with other problems, in women with problems like um incontinence, prolapse, women undergoing menopause, in the various stages of menopause, when they are feeling a lot of dryness, a lot of other things. So we as physiotherapists can definitely help them in those situations. So before I give you to the solution, I'll just go back to the previous slide because I'd like to highlight two other points. So where we are in the period of the prenatal area, a lot of women suffer from gestational diabetes. Now, gestational diabetes, the true form of gestational diabetes, on its own would subside after delivery, but the potential problems that it can cause during those 9 months to the lady and to her baby are great and are dangerous. It can almost be life threatening at times. It also increases the risk of diabetes later on in life for both. And it sometimes, because children are underdeveloped but they're huge, really huge in size, the deliveries happen much early, and then there's a lifelong problem for that child, or even survival at times could be a problem. So physiotherapy can help subside that to a great extent, or manage that to a great extent. Physiotherapists are and especially women's health physiotherapists are really well trained to identify what patient could be more susceptible to it, help them with the correct dosage of exercise that they need, and also sometimes guide them with some nutritional support, or assist them or give them a contact from where to get the nutritional support, so that the diet and exercise, which is going hand in hand, can really work wonders in control this gestational diabetes. Also, another very less spoken about and less identified issue, actually, I would say, is diastasis recti. A lot of women post pregnancy suffer with diastasis recti, but they actually don't know what's happening to them. A lot of women who are really obese also tend to suffer, irrespective of their status of delivery or pregnancy, tend to suffer with diastasis recti, but they usually don't know what's happening to them. So now, diastasis recti is actually a situation where the rectus abdominis, the muscle in the front of our stomach, splits into two, and it doesn't join back. It's most commonly because of delivery, post-delivery, and also because of weight. So women's health physiotherapists are specifically trained in assessing and treating this condition. Though it takes time, it takes effort, but we can come out of it. And once the diastasis is solved, many problems like backache, menstrual pains, knee pains can automatically be taken care of, because these muscles are large group muscles working in hand with each other. So they can really be well taken care of if we know the cause. Even incontinence, to some extent, could be linked to cases like that. Many times people are talking about other problems and they tell us that I have a lot of constipation. So it's very wise to ask them about other problems which could be arising due to chronic constipation. Cases like incontinence may stem up from chronic constipation, and this is where women's health physiotherapists are really trained and aware of where and how to find problems in the nascent stage, so that the woman need not suffer for long and it can be helped very early on. So let's go on to the solutions. So even though life does get tricky, and sometimes women don't know what's related to what. Everything does have a solution. We just need to find the right moment, the right person for it. So how your physiotherapist or your women's health physiotherapist would help you get out of these problems? So first of all, you need to know we are trained to identify the stressors, identify the cause of whatever symptoms you're complaining about. Then we will, not we could, but we will help you understand how the biomechanics of it is connected and how to reverse that. Physiotherapy is a big umbrella word. It gives us various modalities, various techniques with which we can attack these conditions, which we can, with the use of which we can address your pains, your complaints. Physiotherapists are educated and skilled for the same thing. We you we address your problems, we help you realign your postures, realign your complaints, be in sync with gravity, be in sync with your own self. Then we can, once the pains are taken care of, we help you strengthen your muscles, strengthen your body for the complete whole unit, for overall fitness, so that these individual problems are no problem. And then maintain it through a structured home program, which is definitely made individually, keeping in mind what you need, and educate for prevention, for reoccurrence, for you, for any condition. So I'll just stress once again on why we would need physiotherapy. Just a second, I might have missed a slide. No. So I'll just come to re-stress on why we need physiotherapy. Physiotherapy is actual modern day practice. It is actually a wonderful part of traditional medicine. It goes hand in hand. It is an adjunct. It is rather a mainstream form of treatment where physiotherapists help with faster diagnosis. Where physiotherapists help with faster diagnosis. We help in drugless therapy. We do provide drugless therapy. We give in a lot of pain relief. And once you are addressing your causes with physiotherapy and coming to the root cause of your pains, of your complaints, you can be rest assured that this is a lifelong solution. It's not going to happen again and again. The myth of going to a physiotherapist every 3 months is far gone, and it can be easily forgotten. Another thing, this year the WHO has given the theme "Break the Bias" for Women's Day this year. So I say we need physiotherapy to help us break the bias. Come back to your fittest self, come back to your fully functional self, and you can achieve anything you want to do in the world. You can truly break this bias. So I'm gonna say, just don't be worried or in any sort of confusion on how to reach your therapist. Just reach your nearest therapist. You don't need a referral. Yes, referrals do come, but it's not a compulsion. You can directly come to your therapist, let them know what your complaints are. They are well equipped to assess you, to examine your problems, to give you a diagnosis, and then also to treat you. Yes, definitely go to a physiotherapist who is recognized by IAP, by the state council, so that you're not cheated on, so that you know you're not going to a quack. But yes, just go ahead and do that. So that's from me. You can just remember as the last message that physiotherapists are muscle doctors, as I sometimes like to put it. So any complaints with your muscular system, you can always approach us and we will tell you how to help you there. So I'll just stop this share now. Yes, ma'am. Any questions?
As if now in a chat we have no questions. You have beautifully put up uh, your expertise very nicely. Uh, I personally from my side, I would like if you can
Yes, ma'am.
highlight something on in case of the incontinence. Uh,
Yes,
Something can be done.
yes,
And
surely.
there's one more question which has come up that can you?
Fibromyalgia.
Yeah.
Yeah, I just saw that pop. So I'll take both these questions. First, let me start with incontinence. Now, incontinence is when a lady complains of urine leakage, a few drops, sometimes much more. Uh, this symptom ranges from a couple of sneezes or coughing loudly to just getting up and walking. And there are women who say, "I have leaked some urine when I just stand up from sitting on a chair or sitting on the floor, and before I can start walking." Incontinence, another form of it, is also when you can't hold your urine or can't hold the feces and have to just rush to the bathroom, or it drops even while you're trying to undress. Incontinence also happens in athletes who are otherwise perfectly fine, but when they are running, when they are jumping too hard, they may feel a leak here and there. So, this is basically the weakness of the pelvic floor muscles. So, like we all know, pelvic floor is a flat muscle, and how I like to put it for many people, it tends to have three orifices, three holes. So, one is for the front, one is for the urine, the second would be the vagina, and the third is the anus. It's in that order. And when this muscle is weak, so just like a rubber band, when your rubber band is weak, it will open up. So these muscles have got sphincters. When these three sphincters are weak, they open up. It's when they open up, they can't hold whatever is inside, and it tends to drop down. So as a physiotherapist, we first start with this explanation so that the lady knows what is actually happening. We first start with this education, then we help them to get aware of what the problem is, where the path is, and how to functionally train it, how to strengthen it, so that they can be out of this. There are even some grades of uterine prolapse. So, just the extension of this is when the pelvic floor becomes even more weak and the walls of the vagina and the uterus start coming down. So, uterus is an organ like this, it eventually starts reversing. So, the earlier stages of this can also be treated with physiotherapy. We may not necessarily need a surgery for that. Yes, the very advanced stages we might need a surgery, but the earlier stages, physiotherapy does wonderful work for it. There are devices for it, there are manual procedures for it. There is a wonderful world out there which can be easily accessed, and it shows beautiful results. And I'll come to fibromyalgia. Ma'am, are you happy with the explanation? So, I'll come to fibromyalgia now. So, fibromyalgia has many definitions. Sometimes people say it's not a concrete word, it's not a concrete diagnosis, but just because it's commonly used and understood, so let's go ahead with it. So, fibromyalgia is a condition where there is a complaint. I hope I'm audible.
Yes.
Yeah. So fibromyalgia is a condition where there is multiple points of pain on the body, and sometimes in a typical patient language, if I would use, uh, patients would come and tell that it's very difficult to wake up and come out of bed in the morning, because even though they've had a good night's sleep, the body is never at rest. It always feels tired, the neck is paining, the shoulders are too heavy, the upper back is painful, sometimes going all the way to the lower back. So, fibromyalgia, in my understanding, is not an individual pain or an individual complaint. It tends to have multiple things happening together, and every patient with fibromyalgia is unique, is different. So when we see the patient, when we assess them, we can see which part is more tensed, which part is better. So we know what is my strong point and what is my tough point, as I'd like to call it, and where I need to pay more attention in easing it. Again, physiotherapy is a big umbrella which gives us a lot of minute things here and there. It gives us electrotherapy, it gives us exercise therapy, it gives us various forms of manual therapy. And a combination of all this is used for fibromyalgia, for treating the pain. With a fibromyalgia case, I would love to first treat their mind, to come out of it, to believe that they can actually break through this circle, break through the cycle, come out of it. And then we address their pains. We do a lot of fascia mobilization, a lot of fascia release, and a lot of strengthening is required so that you don't fall into the same trap again. Yes, ma'am.
Thank you, Dr. Komal. There's one question which is raised that what are the post-menopausal problems faced which a physiotherapist can refer to?
So, I would just slightly differ with you with regards to post-menopausal because I said menopause is a long time frame. So many a times what we call post-menopausal is actually happening in that technical menopausal time frame. They are more correctly perimenopausal than post-menopausal, as I would like to personally put it. And a lot of women complain of hot flushes which don't go with medicines, but if you give them a wonderful format of graded exercises, it really helps. Then we've had women very commonly who tend to put on weight around this time. Now naturally, menopause is a sensitive time. The nutritional demand of the body is different than what it was just a year ago. And if that is not met with because they are unaware of it, so the body will go into a lot of degeneration at the muscular and at the bone level. So suddenly ladies who are really fit start having knee pains, start having osteoporosis. That's where the role of the physiotherapist comes in. If we can guide them the perfect format of exercise, from whatever diet they're having, their body would know what has to be absorbed and taken in where. I hope the network is fine.
Yes.
Yeah, so I'll just go ahead with it. So menopause complaints are generally hot flushes. Chronic fatigue again comes in as a common complaint during menopause. Then there are joint pains, obesity, sudden increase in weight gain, vaginal dryness, and painful intercourse is also one very common complaint that happens at that time, which can be helped by physiotherapists with the help of proper pelvic floor rehabilitation. That includes a lot of exercises, it includes a lot of other maneuvers, but it gives wonderful results. Yeah, I saw one message here. So I think I'll take the next question. That is, what would be the role of physiotherapy in PCOD?
Yes.
So PCOD again is sometimes called PCOS because it's no more defined as a disease but as a syndrome. That's a group of complaints which are pretty much similar in most of the cases and give similar problems. So PCOS or PCOD, there's one major issue is where there's a lot of peripheral androgen coming up, which interferes with the cycles, with the menstrual cycles. So if the physiotherapist can address this woman, this girl or the lady with regards to what are the other complaints associated with this that she's facing, give her pelvic floor training, give her a nice core training, so there would be a lot of change which would happen. A lot of fascia release is required with these cases, a lot of strengthening is required with these cases, which puts them eventually on a much better lifestyle which they are able to sustain. If you see them these lifestyle changes anyone can make, and a lot of people do. It's very common to see people who are doing a lot of diets and a lot of exercise for PCOS, for PCOD, but they can't stick to it because of the small minor problems that they are facing which interfere with these exercises. If this person comes to a physiotherapist, we can correct their entire ergonomics, their entire format of performing whatever fitness they are trying to do, and that would eventually give them success to fight PCOS. This is similar to how the UN, I think 2 years ago in 2020, had put a call for physiotherapy for mental health. Now, a layman, or I think just somebody would find it very weird. What's a physiotherapist doing for mental health? That's psychiatry, that's psychology, XYZ. But if you just realize, when a lot of pains and aches are taken care of, a lot of physical activity can be done, and any physical activity done when correctly would release the right chemicals in the brain, our endorphins, our feel-good factors, which eventually help them fight the primary complaint, which was not directly linked to us.
There's one question raised by Dr. Bamba. Is
Yeah.
training exercises safe
For elderly women.
women?
Absolutely safe, as long as the weights are graded according to her individual capacity. They are absolutely safe, because in fact when she does exercise with these weights, the calcium absorption is better, so the bone degeneration slows down. So it's definitely much suggested. It's really good for them, and it's absolutely safe. And there's also one from Tejashree ma'am with regards to diastasis recti. Yes ma'am, physiotherapy thoroughly works in diastasis recti. In fact, I can go ahead and say there's practically nothing except for a surgery which would otherwise work on diastasis recti, and physiotherapy can beautifully treat a lot of cases of diastasis recti. I have personally had cases with 4 or even 5 fingers of diastasis recti, and we have cured them. They are fit and fine. The diastasis is resolved, and they're doing everything possible, everything that they like to do. It's a matter of technique, it's a matter of time, but it's definitely we can cure it. Yes ma'am, any more questions?
I think Natindi, Mrs. Pallavi wants to ask something.
Ma'am, I can't read it on my screen.
Pallavi Parab has hands
She
up.
can put up in a chat box. Can she do that?
I think she wants to speak. Let her speak.
Yeah,
She
we
can
can
unmute.
unmute herself.
Yeah, we have unmuted her. Ask Dr. Pallavi, can you just speak? Put on your mic and just speak. Dr. Pallavi?
Yeah, can.
Okay, so I think she is not seeing this some technical problem maybe.
Yes.
So Dr. Kamal, can you tell us that how much important it is for women to remain fit, working women? Because we know that they tend to neglect their health because they have to balance between work and household activities. So what are your suggestions for working women? What could be a easy work and fitness schedule for them?
Yes, ma'am. So I think we are all working women, and we do realize that if we are unfit, then the house and the work, the clinics, the hospitals would all go for a big toss. So definitely, it's of great importance that we are fit. And but I don't believe in a one for all tablet here, because we need to. It's always wonderful to have your own minute nuisances, your minute situations corrected first. I have a little pain in my hand, no problem, it's been going on, but I'm hitting the gym every day. So this pain in hand would always go into repetitive trauma. It would never really, subside. And that hitting to gym and maintaining my weight in a particular frame and doing so much of cardio or XYZ every day doesn't call me as fit. So I say it's a very individual thing what fitness is, but the common core of it is first ensure all your minute aches and pains are resolved. You are in a good posture. I'm not saying stone straight all the time, but a really good human posture, and you are doing what you're doing in the correct technique. Today, if you're doing yoga at home, it's wonderful. If you're going to the gym, it's wonderful. You cycle on the roads, you swim, everything is wonderful as long as we know the technique and we are doing it. Definitely, there's nothing more important than staying fit. Whether you are working outside your house or working inside, because even being a housewife is a full time, though unpaid job.
Dr. Komal, what are your experiences during this pandemic time related to the women's health?
It's a mixed review, ma'am, because a lot of women actually took up wonderful exercises, and a lot of my patients had some queries, again as I said, with some minute issues, and they could solve it as I guided them even at home, or whoever could come down to do that. And it's really a mixed bag, because yes, there are a lot of women who are really overburdened, and they end up with a lot of predominantly cervical issues. But yeah, once things opened up, we could help them out. Yes, ma'am.
Yeah, as you rightly stated, because in pandemic time there were a lot of issues which were raised and the demands were of different variety. Sure. Yeah. Any other question? I think you have put up everything so right. There are not much questions which are coming up.
I am so happy that I could address everybody's thoughts and bring in a mixed bag of everything, because I think the time was also pretty limited. I couldn't go into one topic in depth, but I've really tried to bring in the most common doubts about every topic.
But definitely we are very happy because it was a beautiful talk and you have touched upon all the important aspects, because the events
Thank you
in
so much,
the
ma'am.
thanks a lot for that, because the event which happens right from the menarche and perimenopausal period or pregnancy, they are beautiful events, but a lot of health issues which comes up with this. And definitely you are the expert who are dealing with this and enhancing and empowering every women towards it. So we are happy that you are there today with us and you have
Thank you, ma'am. That's a
touched upon
great
all
honor.
these topics. Thank you. Thanks a lot. And I would like to say a vote of thanks to our central team for giving this opportunity to us and present a speaker like you in front of the budding physiotherapists and those who are going to deal in this particular specialized area. Definitely uh, uh, we would like to say thanks to even our technical team, Dr. Manisha, Dr. Darshana, Dr. Amit Gire, for the constant support and encouragement throughout our sessions. Yes.
I'd like to just take a moment. I'd like to actually thank everyone from the IIP Navi Mumbai and IIP Maharashtra cell for giving me this wonderful opportunity. It's really an honor to be in front of my seniors, in front of my teachers, and to present my point of view. And I would especially thank Dr. Bharti Bilare, who's been a great support in motivating me and shaping my ideology and shaping my thoughts, and my husband, Dr. Vivek Kakkar, for being a constant push in helping me, or in motivating me in working in my field, and definitely every one of you. Thank you so much.
Thank you, Dr. Komal.
Thank you, Dr. Komal. That was a nice talk. Very interactive session. Thank you so much.
Thank you for Dr. Tejashri Madam for nicely moderating this event. And Dr. Mova Chatterjee Madam for panelist. And thank you for the great speaker and all of the technical team on behalf of IAP Navi Mumbai district.
Thank you, everyone.
Thank you. Have a nice day.
And see you soon in some good events further which are planned.
Thank you. Thank you for the participant. We'll keep patience and attend the whole meeting. Thank you.
We'll soon come up with some more interactive sessions in future also. So we all be prepared for that.